All right, so let's introduce our guest speaker. I feel like it's time for that. Daniel Alvarez, LCSW. Daniel Alvarez is the story of a banker of Florida Voices for Health. In this role, Daniel collects the stories of Floridians facing challenges caused by limited access to health care. Boo! The high cost of insurance and other barriers to care. Daniel is also a licensed clinical social worker in Florida with experience in community and school-based mental health settings. Given his interest in the advocacy, Daniel has served as the legislature chair for the Miami-Dade unit of the National Association of Social Workers, Florida chapter for almost 2 years. Daniel received his master's of social work from Florida International University and his BA in anthropology from the University of Florida as well. And again, I introduce to you guys Daniel Alvarez. Daniel, please enlighten us.
Hi, everyone. It is a pleasure to be with you all today. Thank you so much for having me. Really excited to be presenting to you all a little bit about what Florida Voices for Health is all about and what we do. I do have a slideshow, a brief slideshow that I wanted to share if possible. Okay, great. So thank you all again. As Rhonda mentioned, I'm Daniel Alvarez. I'm the story banker with Florida Voices for Health. And yeah, let me get started by telling you a little bit about Florida Voices for Health. So Florida Voices for Health is a statewide health advocacy organization, and our mission is to increase access to healthcare for low-income and middle-income Floridians. And our biggest function in furtherance of that mission is capturing and sharing the stories of impacted Floridians. So we work with them to hear about what they're dealing with and experiencing, and empowering those Floridians to share those stories with decision makers themselves. Then we also bring those stories to decision makers and to the media to really just tell the stories of what people are going through in our really complex healthcare system here in Florida. We do all of this in support of different policies that would increase access to care for that population of impacted Floridians. And so as I mentioned, we do story collection, but we also lead a couple of coalitions, and we're lucky to work with some really great partners in the coalitions that we lead. I want to just emphasize that at Florida Voices for Health, we recognize that to change the system the way it needs to be changed, we know that we can't do that work alone. And that's why we place such a heavy emphasis on collaboration through our coalition work. And I'm going to get into a little bit about the coalition work that we do in just a moment, but first just wanted to explain a bit about the main issues that we work on in Florida Voices for Health. One of those main issues is Medicaid expansion. And we aim to increase access to care for people in the coverage gap. As Ms. Sanchez mentioned earlier when she was speaking to us, seeing that Central Florida Jobs for Justice is working on similar issues. So I'm really excited to hear that. Another area that we focus on is improving access to oral health care or dental services. And in addition, we seek to strengthen consumer protections. So we seek to help address whatever policies we can to protect the rights of Floridians as healthcare consumers. So as I mentioned before, we believe in collaborative work and in partnering with people to pass policy. And there are a couple ways that we aim to do that. One of those ways is through our consumer action team. So as I mentioned earlier on, one of our biggest functions is story collection. You know, we work with people to collect their healthcare stories and to elevate their stories. But beyond that, we're working to help those same impacted Floridians who share their stories with us to be part of the process and the conversation as much as possible, and to also be part of the legislative process. So that's what we're working to do within the consumer action team. For our consumer action team, we actually invited all of the storytellers who have shared their story with us to participate in this space where we're working on strategic plans to help address the issues that brought them here to share their stories with us in the first place. So some of those committees that we have within the team are a committee on access to care, a committee for disabilities, for administrative accountability, as well as for mental health and oral health services. So we're trying to get the stories of our consumers in the media, in front of lawmakers, at press conferences, and through writing letters to the editor. And our consumers on the consumer action team are involved in those efforts. And then, of course, the other aspect of our collaborative work is coalition building. At Florida Voices for Health, as I mentioned before, we put a really heavy emphasis on coalition building, and I'm going to now explain a couple of those coalitions that we are part of and that we help lead. So Healthcare for Florida is one of the coalitions that we lead, and this consists of organizations and individuals who are working to advance Medicaid expansion in Florida. And to find out a bit more about the Healthcare for Florida campaign, the website is right there on the screen, healthcareforfl.org, if you'd like to learn more about it, and as well as join the coalition. Other aspects of our collaborative work include working with groups like OPEN, or the Oral Health Progress and Equity Network, which is our oral health coalition. And then as far as disability advocacy goes, we're currently working with a bunch of partners on disabilities issues to help address access for people with disabilities in Florida. And then we also have our general Florida Voices for Health coalition, which is just a general list of partners across the state that consists of providers, community-based organizations, labor unions, and other stakeholders. And we just generally keep them informed on health policy changes. So we have a monthly coalition call for people who don't necessarily have a specific issue area that they want to focus on. It's also for people who are in the healthcare industry or just in general in the advocacy field. And this is a space for them to just be informed on what's happening in healthcare. So if you're interested in signing up on the mailing list for our general Florida Voices for Health coalition, please feel free to email me. I'll have my email up in the on the last slide, so you could feel free to reach out. I also wanted to just highlight that in terms of partnerships, we're always looking to partner with organizations who are doing good work, who we can support, and who are willing to plug in with the work that we're doing. On the story collection front, our biggest function is to set up story referral partnerships by working with organizations who can connect us with people who have healthcare stories to share. So some of those partnerships that we have currently going include the University of Florida Equal Access Clinic, the Epilepsy Foundation, and the Family Healthcare Foundation. And we also have a document detailing the establishing of referral partnerships, like the process that goes into that. So if anybody's interested, I can definitely send that along, so we could collaborate in that area as well. And so I wanted to just mention as well, I know that you're all working on Medicare for All. And so capturing stories of people who are uninsured and underinsured could really help make the case for Medicare for All, or for the need to expand access to care for everyone. And that being said, that brings me to the question of how can you get involved? One area where we can work together is, you could help us with story collection, which goes toward advancing legislation through the elevation of people's healthcare stories. If you're coming across people who have stories of being uninsured, living in the coverage gap, but you don't have time, or you have limited time or limited capacity to capture these stories, Florida Voices for Health can assist in that work. We can do that work, and we could capture those stories, share them back as written narratives, and through video format as well. We can send those stories over to you, and those stories can help advance the cause that you're advocating for as well. I mentioned before a little bit that part of the philosophy at Florida Voices for Health is that through the sharing of stories, that's how we get to a position of impact. And so we really take the time to package these stories into a way that's useful, and that's at the essence of our story collection partnerships. You can also help with specific areas of legislation that we're seeking to advance that I mentioned before, like Medicaid expansion, or in the oral health arena, we're working on passing a comprehensive Medicaid adult dental benefit. And then in the disability space, we're working on passing legislation to strengthen the system for people with disabilities. And this focuses on accountability and transparency for the agency for healthcare administration, as well as for the agency for persons with disabilities. In addition to joining the story collection referral partnership and helping advance legislation, there are many other ways to help as individuals and as an organization through 3 different areas of work. One of those is through community outreach and education. So you could help us find opportunities to present to the community at large, or we could even help train members of your campaign or your organization, if needed, to present to the community at large. We could work on co-hosting virtual events together. We could work on, if you're hosting an individual event and you wanted someone from Florida Voices for Health to present, we'd absolutely take that opportunity. In addition, we could work on partnering on communications activities and media outreach. So if you have an idea to host a press conference and you would like to engage in that together, your campaign and our work we're both highlighting stories of people who are uninsured. So we have a shared interest in sharing, in changing things for people who don't have access to healthcare. We could also assist in writing letters to the editor for those individuals that if they have healthcare stories to share. And we could try to work on incorporating our work into media outreach activities as well. And finally, I wanted to just mention, as far as legislative outreach goes, if there's pieces of legislation that we both support as organizations, we could partner in going to meetings with legislators together. Another area that Florida Voices is trying to emphasize, at the moment, in terms of its legislative outreach is in building our presence in Tallahassee. So we're trying to recruit as many people as possible in that effort of building that presence. And if you're interested in being part of that effort, definitely feel free to reach out and get involved in us in kind of building that presence of healthcare advocacy in Tallahassee. So I know that I'm pretty much out of time, so I wanted to leave the floor open for questions and leave my email as well on the screen there in case you'd like to take down my email, ask me any questions regarding partnerships or collaboration. I'd be more than happy to answer those questions as well.